First up right now at 5:30, an Eyewitness News exclusive. A bad situation gets worse. That's how Connecticut Children's is describing the latest surge of mental health cases among children.
And it really is happening all across the country. The explosive demand obviously putting a strain on hospitals, specifically emergency rooms again. We first told you about the alarming trend in February.
Channel 3 Eyewitness News reporter SHAWNTE PASSMORE is looking at how an intervention saved a family from some heartbreak. SHAWNTE?
Mark and Aaron Children's Hospital is saying this is key. Intervention may lead to prevention. In Davine Manson's case, she did not bring her daughter to the emergency department, but had she not seen the warning signs, she fears what the outcome could have been.
Nicholas now means now. Mom yells from the foot of the stairs.
Madison Manson is a vivacious 10-year-old.
I like that I can see my friend and then also make new friends.
But when schools went remote in March of 2020, her mother, Davine Manson, noticed a change in a then fourth grader.
I noticed depression setting in on a 9-year-old at that time. She was 9.
The isolation and new normal uprooted her world and the way she saw herself. Thinking about that dark time broke her down.
I wanted to make bad comments about myself and all that type of stuff. Sorry.
We took a break during the interview. Madison later explained how the disruption to life affected her.
When I was inside the house all day, every day, that was just making me feel sad and stuff.
My youngest client is 6 years old.
Clinician Beth Ann Ververt at the Village for Families and Children did not treat Madison, but she's seen similar cases.
So we're seeing a lot of increased anxiety right now, a lot of depressive symptoms.
At Connecticut Children's Medical Center, doctors are seeing a surge that's overwhelming emergency beds used for mental and behavioral health visits.
About 57% of the children with behavioral health issues coming to our emergency room are coming by ambulance.
President and CEO Jim SHMERLING tells me families had to wait days to weeks before receiving psychiatric care elsewhere after visiting the ER. His message to parents tonight.
The earlier the intervention, the more effective it will be.
That's exactly what Davine did for Madison. As part of therapy, the fifth grader worked with farm animals where she gained her confidence and bubbly persona again. If you're a child or parent, Madison wants you to know there's hope.
I would tell them to be brave. You can get help and stuff. If you know you're going through stuff like that, don't be afraid to ask for help.
Let me tell you, Madison is a brave and wise girl. She also said her faith helped her through that time. And listen, there are so many avenues to get help. If your child needs it, we have some resources for you on the Channel 3 app. Live in the newsroom tonight, SHAWNTE PASSMORE, Channel 3 Eyewitness News.